into organs, the liver. I mean, this thing is an absolute powerhouse, but even it has a breaking point. And when it gets pushed past that point, well, that's when we see a condition called cirrhosis. And we're going to break it all down in 5 parts. First, we'll look at what's actually happening to the liver. Then we'll get into the usual suspects. What causes this? We'll explore the nitty-gritty of the scarring process itself. After that, we'll talk about when symptoms start showing up. And finally, and maybe most importantly, we'll see how we can actually fight back. Okay, first up, the liver under siege. So I want you to picture your liver as this massive, bustling chemical processing plant. It's working 24/7. Well, cirrhosis is what happens when that entire plant has a catastrophic meltdown. So what is it officially? The medical definition talks about the loss of the liver's normal lobular architecture. Now, what that really means is that its beautiful, organized structure gets totally wrecked and replaced by 2 things. These things called regenerative nodules and fibrous scar tissue. Basically, all the useful working parts get swapped out for these useless clumps and scarring. Yeah, to put it another way, imagine all that intricate, high-tech machinery inside our factory just getting ripped out. And in its place, just scar tissue and these dysfunctional nodules that don't do anything. It completely changes how the organ works, or more accurately, how it stops working. Okay, so that naturally leads us to our next question. Who are the culprits here? This brings us to part 2, the usual suspects. What on earth is causing this level of destruction? Well, it usually comes down to 3 major players. First, no surprise, is alcoholic liver disease. Next up, you've got viral infections, specifically hepatitis B and C. And then there's a big one that's becoming more and more common, NASH. That stands for non-alcoholic steatohepatitis, and it's often tied to obesity. You know, these 3 right here, they're responsible for the vast majority of cirrhosis cases. But of course, they aren't the only ones. There are other key causes too. You've got certain metabolic diseases like Wilson's disease or hemochromatosis, where you get a buildup of stuff like copper or iron. You can also have major vascular issues like blockages in the veins, or even problems with the bile ducts. Now, this is pretty fascinating. The cause of the cirrhosis can actually change what the liver physically looks like on the inside. So, for example, damage from alcohol tends to create these really small, uniform nodules. We call them micronodular. But damage from something like viral hepatitis, that often leads to larger, more irregular nodules, or macronodular. It's almost like a forensic clue that helps doctors figure out the why. All right, so we know what cirrhosis is and who the main suspects are. Now, let's get into the how. Section 3, a scarred interior. We're going to zoom in and look at the step-by-step process of how this destruction actually happens. Okay, so it really is a domino effect. It all starts with a trigger, some kind of injury to the liver. This injury basically flips a switch on these special cells called stellate cells. Once they're activated, they just go into overdrive, pumping out collagen, which is the main ingredient in scar tissue. As the scar tissue, or fibrosis, builds up, it starts to squeeze the blood vessels inside the liver, blocking blood flow and creating this really dangerous traffic jam. And that traffic jam, that pressure backup, it has a name. It's called portal hypertension. Think of it as super high blood pressure, but specifically in the portal vein, which is the main highway for blood going into the liver. The scar tissue is essentially acting like a giant dam. And when the pressure building up behind that dam gets to a certain point, specifically a gradient of 10 millimeters of mercury or more, that's when things get really serious. So this brings us to a really important part of the story, section 4, from silence to symptoms. Because here's the scary part. For a long, long time, all of this internal damage can be happening completely silently. So the big question is, when does the body finally start waving a red flag? You can really think of cirrhosis as having 2 different phases or stages. First, there's the compensated stage. Here, the liver is definitely scarred, but it's still, compensating. It's managing to keep up with its job. Someone might feel kind of tired or notice their sleep is off, but that's about it. But then you hit the decompensated stage. And this is when the liver just can't keep up anymore, and those really severe, really obvious problems start to show up. And one of the biggest turning points, a really critical sign, is something called ascites. This is when fluid starts to build up in the abdomen. And more often than not, this is the very first sign that the liver has crossed that line from compensated to decompensated. And there are a bunch of other physical clues you can actually see. Jaundice, that yellowing of the skin and eyes, That happens because the failing liver can't clear out waste products. You might also see red palms, or these little spider-like blood vessels on the skin called spider angiomata. And remember that blood backup we talked about, the portal hypertension? Well, that traffic jam often causes the spleen to get bigger too. Okay, so this all sounds pretty grim, but that brings us to our final and most hopeful section, fighting back the damage. How do we actually diagnose this for sure, and what can we do about it? So how is this thing officially diagnosed? How do doctors go from just suspecting it to knowing for sure? Well, the classic gold standard has always been a liver biopsy. They actually take a tiny piece of the liver and look at it under a microscope. It's invasive though. But thankfully, now we have this amazing non-invasive alternative called elastography or FibroScan. It's super cool. It basically uses sound waves, kind of like an ultrasound, to measure how stiff the liver is. Why? Because scarred fibrotic tissue is way, way stiffer than healthy liver tissue. And here is the number to remember. If that FibroScan score comes back higher than 13.5 kilopascals, or kPa, that is a very strong indicator that cirrhosis is present. It gives doctors a clear, objective number to work with. Blood tests also give us a ton of clues. For instance, the liver makes a key protein called albumin. When it's failing, it can't make enough, so the ratio of albumin to another protein, globulin, actually flips upside down. We also see a classic pattern in liver enzymes, where AST becomes higher than ALT. And that portal hypertension? Well, the enlarged spleen starts trapping platelets, so your platelet count in the blood plummets. It all fits together. So what about management? It's really a three-pronged attack. Number one, and this is absolutely the most important, you have to treat the underlying cause. That means stop drinking, take antiviral meds for hepatitis, address obesity. Step two is to manage all the complications, so using diuretics for the fluid buildup or beta blockers to lower that portal pressure. And then for end-stage disease, the only true cure is a liver transplant. When you look at the whole picture, cirrhosis is really a critical turning point. It's a stark reminder that even this incredible organ has its limits. And the final question it leaves us with isn't just about how we manage the damage once it's done. It's a much bigger question. Knowing what we know now about the causes, how do we prevent this from ever happening in the first place?